Welcome back, dear viewers, and our first guest of the evening is Dr. Ramnarayan Ramachandran, consultant neurosurgeon and functional neurosurgeon. Doctor, good evening. It's really a pleasure to have you here with us on Hello Kuwait.
Thank you very much. In fact, I am also happy to be with you.
It's really our pleasure, Doctor. So I'm wondering if you can tell us, please, about your specialty at the start, please.
See, basically, I am a neurosurgeon. I am sure you know what is neurosurgery. Neurosurgery deals with the surgeries for the brain, spinal cord and nerves and all that. Okay. I have focused further and trained further to do what is called restorative neurosurgery. So, as the name implies, restorative means restoring.
Exactly.
So, I do surgeries which will help to restore lost nervous functions.
That's really great and interesting and also inspiring to others, Doctor.
Okay.
So what about one of the main subjects or one of the main diseases and the most talked about diseases in your specialty is the Parkinson disease?
Yes.
So will you please tell us, Doctor, about the Parkinson disease?
Okay. See, Parkinson disease is what is called a movement disorder. Okay. Whatever we do, it's a movement. So, for example, now I am talking. That's a movement because my jaws, my tongue, all this are moving.
Exactly.
So walking is a movement. Your leg is moving. So, most of the things we do are movements. And
Exactly.
when there is a problem with movement, we call it a movement disorder. And
Exactly.
Parkinson disease is a commonest movement disorder in the world. It's the most common movement disorder in the world.
Definitely.
Okay. So, if you ask me what causes Parkinson disease, in fact, that's what I think you meant with your question. So, suppose I tell you please get up, go there, stand there for 1 minute, come back and sit here. I am telling you. You are doing so many things, and what I do is I am taking a video of all your movements, and then I do a slow motion view it in a slow motion.
That's great.
What will happen is there is something around, you will be doing something around 200, 250 movements. Even though we don't know because we are getting up and going and coming back and sitting thousands of times every month. Each movement is coordinated from the brain, and for this coordination you need a chemical called dopamine in the brain. It's somewhere deep here, you have this dopamine. It is a dopamine chemical which helps us all these perfect movements for us.
Exactly.
In Parkinson disease, of course, they don't know why this happens, but in Parkinson disease, this dopamine level becomes less and less and less. It is like, I'm sure you know, in diabetes, the insulin level comes less and less and less. Same in Parkinson disease.
But with dopamine.
Dopamine becomes less and less. So, naturally what happens, it becomes, the movements get affected. So, that is why it's called a movement disorder.
Exactly. Exactly. And doctor, how about like diagnosing the Parkinson? How do we really diagnose, or before diagnosing also the symptoms? Like, for example, you gave me an example about me walking around. Can you detect people earlier, like when it comes to Parkinson's disease, like from their walk, from their movement, even if they look natural to people who are not experts?
Okay. Yes. In fact, that's a good question. In fact, we diagnose Parkinson by the clinical features only. So, the main clinical features as one is what you call pill rolling tremor. People get a tremor like this. When they are resting, keeping their hands like this, their hands will be like this. Second is they become very stiff. The muscles and all become very stiff, rigid. We call it rigidity.
The early signs.
That depends. In some people, this tremor is early sign. In fact, in many people, at least some 10% of the people come to me because the check they give to the bank is returned back because their signature changes.
Interesting.
Okay. So, we call this micrographia. What happens is as you write, your handwriting becomes smaller and smaller and smaller.
Oh, it's one of the signs.
Yes, that's one of the signs. A lot of people come and say, doctor, last month I gave check, the check is returned back and now the bank is very angry, they are creating trouble.
And they're writing without shaking, like when they do it early.
They may or may not have shaking, but when you ask them to write, their handwriting becomes smaller and smaller. We call it micrographia. It is not so naturally signature is important. In a check, signature is important.
Exactly.
Second thing is this tremor. A lot of people come with this tremor. The tremor
They
starts slowly and increases.
Exactly.
Then this stiffness. Then other thing a lot of people notice is they become very slow. See, for example, suppose I want to walk from here to there, it will take me say 2 seconds. But somebody with Parkinson may take even 5 minutes to walk up. They cannot walk.
Notably slow.
Notably and miserably slow.
Exactly.
So, and then there are other signs like some people develop hallucinations, so many other signs. But these are the 3-4 common presentations, but there are some other signs also.
Exactly. And doctor, about the next step after diagnosing and knowing the symptoms, what about the treatment options that are available, especially for people who are early with Parkinson?
Yeah. See, in fact, I would like to put one thing in between. Whenever a patient, once you diagnose clinically, we basically ask them to do an MRI, because there are so many other conditions which mimic Parkinson disease. You see, for example, there is a condition called normal pressure hydrocephalus. There is fluid accumulation inside the brain.
Exactly.
There is no dopamine is normal there. So if you cannot treat that patient for Parkinson disease, because he is not having Parkinson disease. He is this normal pressure hydrocephalus which is causing Parkinson like symptoms, this tremor.
It can be misdiagnosed.
Yes, it is a mimic.
Exactly.
A mimic. So first always we do get a detailed MRI study, and if the MRI shows that it is a Parkinson disease, then we have two methods of treatment. One is obviously medical management, medicines, drugs. There are very good number of drugs, and what I want to tell you is, as we said earlier, suppose somebody has vitamin deficiency, what do? You give them vitamin.
Exactly.
Very simple. So here we know that there is dopamine deficiency. So the dopamine in a chemical form, in a tablet form, can be given to patients. Exactly. So that's available, and it can be given to the patients, and most of the patients do very well with medicines.
Exactly.
In fact, some of them won't even believe that they were say you see them today, and after 1 month you see after medicine, you won't believe them that this is the same person whom you saw so slow like this, coming like this to your clinic.
Exactly.
Medicines work well, but unfortunately what happens is, over a period of time, the medicine starts losing its efficacy. That is, suppose you start at the 2 medicines, then you will require 3, you will require 4, you will require 5. So the medicine dose gets increased. So the time of effectiveness of the medicines comes down significantly.
Exactly.
And second thing is, so naturally what the doctor does, he will increase the dose.
Exactly.
When you increase the dose, side effects start appearing.
Exactly.
There are a lot of side effects due to medicine. So by 10 years, most of these people get side effects.
Exactly. And doctor, about the, is there any behavior or any body abusing from the from the person self that leads to get a Parkinson, or any habits that lead to get a Parkinson disease?
Yes, in fact, one I didn't mention that because it's a big list. One of the problems is they get hallucinations. In fact, now I am actually having a witness in a court case where the patient believed that his wife is going around with another man and slash that hallucination.
Suspicion.
Yes, hallucination is a major problem, and hallucination anywhere is a major problem.
Exactly.
So it can happen. And then I have another patient who cannot stop his eating. He will keep on eating, and after my treatment, he became normal.
That's really great.
Yeah.
And doctor, about sometimes, like some people believe, like smoking can lead to different diseases.
Yes.
For example, abusing of drinks or anything that is bad, it can hurt the body.
In Parkinson, pesticides have had definitely a big role, especially some type of pesticides which you use for the agriculture, because they have found that people coming from agricultural areas have much higher incidence of Parkinson disease than from cities and all that.
Exactly.
Can I finish the treatment part of it?
Yeah, please.
Yeah. So we give medicines. See, initially medicines do very well, but most of the patients over a period of time, by 10 years and all, the medicines become practically not effective, and they cause side effects also. In these patients, we do a surgery called deep brain stimulation. Okay.
That's great.
So this surgery we call DBS as short form. This involves putting electrodes into the brain and putting a battery here and connecting it through the, everything is under the skin, nothing is visible outside. And when we tune the battery, their symptoms become normal.
That's really great. And what about the follow-up, doctor?
Yes. So what we do is, we do, of course, as I said earlier, in fact, I want to point out one very important person,
Please.
Mr. Muhammad Ali, the boxer.
Exactly.
He was not doing very well with medicines. They did not do surgery for him. The reason is, this surgery will not be effective for everybody. That is, if you have 100 Parkinson patients, so probably 60 or 65 people only will benefit from the surgery.
Exactly.
So when you suppose you know somebody with a Parkinson, you send him to me. I as a doctor will have to do a lot of tests to see whether this particular man will benefit from the surgery or not.
Exactly.
Only if he benefits should I do the surgery, because it's a brain surgery, it's not a joke.
Exactly.
And it will not benefit everybody. 60-65% will benefit, 30-35% will not benefit. That's why, Muhammad Ali boxers, there's so many, and there's a big list of people who never got operated, even though they could afford to, they could, everything, they could get it done, but they never got operated because they won't benefit. And the follow-up of the surgery is there's a battery, I told you, there's a battery. So we have to tune the battery once in a while. So they have to come back to me as a OPD, but it's a OPD procedure. They have to come back to me once in a while, and we just, from outside we have got a small, like a small iPad, not even iPad, like a small tablet. I use a tablet, the patient will be sitting there, and I can use a tablet to adjust the current. Exactly. So based on the patient's requirement, we give them the necessary current, necessary parameters of the battery.
That's really great and well said from your behalf, doctor. And also there is another subject in your field that people are wondering about. It's spasticity.
Yes.
So will you please, doctor, tell us more about spasticity?
Sure. See, spasticity, of course, is it's a medical word. Basically, if you want to translate into common language, it is stiffness of the muscles. So that's why medically we call it spasticity. Okay. Spasticity is, see, as the word explains, it is very stiffness of the muscles of the hands and the legs due to various conditions. And the common conditions which we see in Kuwait and in the Middle East is, or GCC, is cerebral palsy. It's a very common problem which is seen in a lot of children. They become very stiff and they cannot walk. When they walk, their legs become like this, and also they fall down. Second thing, especially in Kuwait, the very common problem is multiple sclerosis. I'm sure you heard of this multiple sclerosis.
Definitely.
In fact, I was told by one patient yesterday that there's more than 15,000 people affected by multiple sclerosis in this country. And that for this population of this country, that's a big number.
It's a huge number, definitely.
In India, if you take 15,000 is not a big number, but in Kuwait 15,000 is a big number. The percentage is a big percentage. Again, people with spinal cord injuries, unfortunately car accidents, they become paralyzed below. Then again, the other thing very common which you see is stroke. People have stroke and one side is
brain
paralyzed.
Stroke.
And then brain stroke. So and then their hands and legs are like this, very stiff. They cannot do anything with their hands and legs. Exactly. So these are some of the situations where you get spasticity.
Exactly.
And based on the involvement, you see, for example, in stroke you get what's called hemiplegia. So one side is affected.
It's temporary. It's temporary.
No, it's all permanent. No, it's
permanent.
Brain damage causes this.
Exactly.
In spinal cord injury or multiple sclerosis, only the legs are affected. So they call it paraplegia.
Exactly.
So that's all different names, medical names.
Exactly. And what about the diagnosis of spasticity, doctor, and also the treatment options available?
Yes. See, the diagnosis again, obviously, first is clinical assessment. Clinically, there is something called a modified Ashot scoring. It's a scoring system. So it's called 0, 1, 2, 3, 4 numbers are there. So you use the scoring system to find out how much is the stiffness, how much is the spasticity. And this is very important because the treatment is based on the score. And the score is from 0, 1, 2, 3, 4. Exactly. 3 and 4 obviously very severe. 0, 1, 2 is mild to moderate. Okay. For mild to moderate, then obviously just like in other cases, you always have to do the CT scan and MRI, because spasticity itself is not a disease. It is a symptom of some problem.
Exactly.
Like, so see, fever is not a disease. Fever can be due to anything. It can be just a viral infection. It can be even a cancer. Anything can cause fever. So just like fever, it doesn't mean anything. Fever only shows that there's something, problem somewhere. That's all. Exactly. Similarly, spasticity shows that there is some problem somewhere in the nervous system. So you do all CT scan, MRI. So many tests are to be done, and you have to come to a proper diagnosis. See, for example, if it is multiple sclerosis, for example, you have to treat the multiple sclerosis also, not the spasticity alone. Exactly. If it is spinal cord injury, you will have to check whether they can do something for the spinal cord injury. So like that, based on that. Then if you come to only to the spasticity, there are again two ways of treating. One is medicines, one is surgery. There are medicines which you can take as tablets, which will help spasticity. And usually as a unwritten rule, what you do is 0, of course, we are all 0, so that no treatment. 1 and 2, usually you give only medical management and with physiotherapy.
It works.
That is a standard all the world. That is a standard treatment that is used, because 1 and 2 are mild. They are not very this thing. It just needs some little physiotherapy and that is enough.
Exactly.
But 3 and especially 4 is very severe. Hands and legs are so stiff. The physiotherapist even cannot move the hand. So stiff.
It can be noted. Like when
exactly. And and if somebody tries to move it forcefully, they can even fracture the bone. It is so difficult. So those cases, tablets and physiotherapy is not possible.
So it leads us to think about or discuss the
surgery as an
option.
Yeah. Exactly. So surgery is an option. Yeah. So there's a drug called baclofen which is very effective. But the problem with baclofen is it is not well absorbed in the stomach, because as you know, any tablet has to be absorbed and digested and then only it will work. So what we do is, I put a pump under the skin here, and we can deliver this baclofen directly into the spinal cord and brain. The advantages of this thing is it is 24/7 365 and it is controlled again with a small tablet. I can control the dose. It is just under the skin. It's not going deep.
Through the pump.
Yes. Yeah. It's a pump. It's a 40. This will be this size, around this size, and it is 40 ml drug is filled in this, and I can adjust the dose from outside. Suppose I want to increase the dose, decrease the dose, I can from outside I can do it.
Exactly.
And this is continuously it is working. So the patient will have continuous relief. Whereas with the tablet, so for example, suppose you call me and say, doctor, I'm having headache. So I'll tell you, okay, you take Panadol. You call me at 10 o'clock in the morning, and you take Panadol 10 o'clock. Okay. But by the time your headache goes, it will be 10:30, 10:45, because the drug has to go to your stomach, get digested, absorbed, and then what happens after 2-3 hours, our kidney will push this drug out of the body.
Exactly.
So the headache will come back.
Exactly.
So here the pump is 24/7 365. So that's very important.
Exactly.
And then after the spasticity is reduced, it is very easy for the physiotherapist and other people to work. Exactly. And most important is, again, just like I told about the Parkinson disease, this surgery is not for everybody.
Exactly.
Again, here we do a lot of assessments and trials and all that, and tell the patient, yes, please do the surgery, you will do very well, or sorry, no, don't do the surgery, you will not benefit.
Exactly.
So the results of the surgery are very good because we are doing it for the correct selected patients. We are not doing it for everybody who comes to us.
Exactly. And doctor, it's one of the most frequently asked questions to you, especially in our region. One of the most common diseases we have is the diabetes.
Yes.
And it's a permanent disease, and one of the things related to it is diabetic neuropathy. So will you please explain to us the diabetic neuropathy?
See, basically, diabetes, we all know what is diabetes. There's a reduction in the amount of insulin in the blood, and so the sugar, the glucose in the blood is on a higher side.
Exactly.
What happens is, this sugar the sugar is necessary for normal life, but excess sugar causes damage to the cells of the body. And what happens is, many of the organs, any organ if you take, suppose you take the blood vessels of my body,
exactly.
Heart, it's a large blood vessel, it goes, then it divides, it becomes 2, then it becomes 4. It becomes smaller, like the
step by step, as they
exactly
say.
Like the pipe system in our house.
Exactly.
A big pipe will go through the road. Then your house is a small pipe. Then finally the kitchen pipe is a small, or the bathroom pipe is a small pipe. Like that.
Same as the body.
The majority of the vessels ultimately they have very small vessels. And in some people, I don't know, probably you must have noticed, you will see pencil line like blood vessels in the eyes and all that, like a pencil will be red.
Exactly.
So most of the vessels, most of the organs will have that type of blood vessels in the last stages.
Exactly.
So kidney and all that. Diabetes actually damages this blood vessel. They block these blood vessels.
Exactly.
We call it microangiopathy. But I am not going into the technical details. In diabetic neuropathy means nerve, neuro means nerve. Pathy is affected. So the nerve is affected. What happens is the legs are long, and the nerves to the legs actually start from the back here, and they go a long distance up to the leg. So they are more than 1.5 meters long.
Exactly.
The nerves are. So again, as you go, the blood vessels also become smaller and smaller and smaller. So the terminal blood vessels are very small.
Exactly.
And these blood vessels actually get blocked during diabetes. So when these blood vessels are blocked, there are two problems. One is there is a lack of blood supply to that areas of the leg, and the nerves going to the leg, the lower portions of the leg, they also damaged.
Exactly.
So diabetic neuropathy, the most important symptom you get is severe pain.
Exactly.
In fact, it is severe burning pain, and if you want me to describe that pain, I will call it as a cry of the dying nerves, because the nerves are dying because they are starved. They are not getting the blood supply. They are
Exactly.
they are not getting food and oxygen.
It's numb.
Yeah. No, numbness comes later. Initially pain.
Exactly.
Pain is actually they are crying for food and water, no, like that. After some time, what happens is the nerve starts, now one by one the nerve, small nerve starts dying.
Exactly.
When they start dying, you develop numbness.
Exactly.
But funny part is, after some time there will be no pain, no numbness, nothing.
Exactly.
But you know what is the problem?
What is
that means the nerve is dead.
Unfortunately.
Then one fine morning you will see there is an ulcer. A lot of people end up having their legs cut off. I'm sure you know. I'm sure you have seen or heard people where their legs.
Because some people refuse at the start, and it gets worse sometimes.
Exactly. That is because both nerve supply also is gone, blood supply is also gone. Because you know, for a normal organ to work, you need both nerves to control it and blood supply to feed it.
Exactly. It's a part of the treatment, doctor, to cut sometimes the legs.
Yes, because if there is uncontrolled infection, if you don't do suppose you know this part is infected.
Exactly.
If I don't cut here, this infection will come up.
Spread. That cannot be controlled.
And people can die. People will die. The infection can be uncontrolled. So people can die. So that is why they are forced to do this. But you know, obviously it's not a very pleasant thing to lose a leg or hand or whatever it is.
Exactly.
It's
but
not, nobody likes it.
It's better than losing life sometimes.
Exactly.
Yeah, and also your the beloved ones, then they will be sad because of the patient's refusing.
Even if somebody we do not know, if we hear that, I'm sure all of you have sometimes you heard, oh, that man had his leg amputated. I'm sure we feel sad, no?
Exactly.
Poor fellow. We'll think, oh, poor fellow, so sad.
Exactly.
It's not a nice thing to hear. Actually.
Exactly. And doctor, will you please give us a brief overview of the surgery and the results and the follow-up?
Exactly. So you're talking about diabetic neuropathy, isn't it?
Yeah.
Yeah. Diabetic neuropathy, basically, as I told you, is the blood vessels are blocked. So there are the best way or the most important thing is, in fact, if you ask me to tell 5 points about treatment, I will say control of diabetes, control of diabetes, control of diabetes, control of diabetes. If you control your diabetes, obviously you know that obviously the sugar cannot cause damage.
Exactly.
You understand?
Well said.
So that is the most important thing.
Exactly.
But you know, sometimes due to various reasons, everybody cannot control their sugar. You know, just like what we say when we talk, we can talk so many things. But when you do practically, it may not be always possible. Exactly. Due to various reasons, because now we are living in a very difficult world. It's not an easy world nowadays.
Exactly.
So what happens is, you know, it's possible that you forget your medicines, you eat more, you go to you are invited to a wedding, you eat more.
Sweets,
human beings, no? You are human beings. No? So we do all these funny things. We can't prevent all this. Okay. So what you do is, there are tablets which will help you get over the pain and all that.
Exactly.
Again, what you do is, there are other methods like taking care of your food, proper footwear, to ensure that you don't get injury to the foot, don't get it. There is even if you think there's a small infection, immediately go to the doctor and get it, take antibiotics and all and clear that. Don't allow it to become a major catastrophe.
Definitely.
You understand? These are things which can be done.
Definitely.
But unfortunately, the problem is, it's a blood supply which is affected.
Exactly.
So what happens is, we have no option but to ensure the blood supply comes back.
Definitely.
So how do you do that? There's no medicines. The only way is surgery.
Exactly.
And this surgery which I do is what is called spinal cord stimulation. That is, I put a stimulator here and I put a battery here and I stimulate. Exactly. And this stimulation, which will go through the nerves, will open up the blood vessels and take care of the neuropathy.
Exactly. Well, thank you so much, doctor, for
you,
the valuable information you shared with us this evening. It's a real pleasure to have you here with us on Hello Kuwait, and we wish you the best of luck, doctor.
Sure. Thank you. Thank you very much. So nice of you.
It's a real pleasure. The viewers, we just had with us Dr. Ramnarayan Ramachandran, consultant neurosurgeon and functional neurosurgeon. Let's go now to check our second report of this evening. It's about emotional intelligence. Stay tuned, we'll be right back.